Now this is the time regarding the live surgery. Anyone can ask or anyone can give opinion from our two faculty, Professor Jalal Ahmed sir and Brigadier Julfikar Hassan sir.
I have during surgery already I have commented that it is a very good surgery. The incision architect was good. The capsulorhexis was fine. The hydrodissection was fine. The nucleus removal was as per rule. The fragmentation was good. The energy he used is logical, and the fragmentation was also good. The emulsification was good. The IOL implantation also I think is good. And one thing, he implanted the IOL, the optic of the IOL was 360 degree covered by the rhexis margin, and wound closure was also good. So as a whole, the quality of the surgery was excellent, and the machine used, he mentioned that it is a Cataract machine, it is one of the best phaco machine, and a microscope is a possible JAIS, and RTBO 3D microscope, it is one of the topmost microscope in the world. So everything was fine. Congratulations.
Just to clarify about the anesthesia, normally we can do the perivalvular block by lignocaine, and even the operation can be done by surface anesthesia, meaning that only anesthetic drop can give the anesthesia for the surgery. এখানে anesthetic যিনি আছেন ওটা this we call attended anesthesia. একজন 60 বা 70 ইয়ার্সের ভদ্রলোক বা ভদ্রমহিলা যখন ওটি টেবিলে থাকেন তখন ওনার অন্য অনেক কোমরবিডিটি থাকে, সেজন্য অ্যানেস্থেটিস্টের কাজ হলো টু অ্যাটেন্ড দি কেস, আদারওয়াইজ কোনো ইন্টারভেনশন দরকার হয় না ইউজুয়ালি। এবং অ্যানেস্থেশিয়া পেরিভালভার দেওয়ার সুবিধা হলো চোখটা নড়াচড়া করে না, কিন্তু অসুবিধা হলো ইঞ্জেকশনটার ব্যথাটা একটু নিতে হয়। আর সারফেস দিয়ে সুবিধা হলো যে ইঞ্জেকশনের ব্যথাটা অ্যাভয়েড করা যায়, কিন্তু চোখটা তখন মুভ করে, মোবাইল থাকে, ওই তার মধ্যে সার্জন দক্ষভাবে ওটা করেন। তো সেটার জন্য অনেক বেশি কেয়ারফুল হতে হয় এবং রোগীর একটু কোঅপারেশন লাগে, এবং সেটার জন্য ব্যান্ডেজ দেওয়ার দরকার হয় না। বাট কার্যত মূল কাজ হচ্ছে লেন্সটা বের করে একটা প্লাস্টিক লেন্স দিয়ে রোগীকে দেখানো, দ্যাট ইজ দি মেইন জব।
Sir, sometimes we ask, please give me the best lens. Is there any single best lens which can answer all the deserve of a patient, sir? Or how we choose the lens?
বেস্ট লেন্স এটা আসলে আমাদের আমরা যারা নন অপথলমোলজিস্ট, আসলে বেস্ট লেন্স বলে ওইভাবে কিছু নাই। আমরা জিজ্ঞেস না, ওনাদের জানার জন্য আমরা জিজ্ঞেস করি রোগীর আসলে পারপাসটা কি। অনেকে মনে করেন যে আমি অপারেশনের পরে চশমা পরবো না, তার জন্য হচ্ছে মাল্টিফোকাল লেন্স দ্য বেস্ট ওয়ান। এক কথা যদি বলি, আমরা রোগীর আমার যেমন প্রোগ্রেসিভ চশমা থাকে সেরকম এই লেন্সের মধ্যে দূরে কাছে সব ব্যবস্থা করে দেওয়া আছে মাল্টিফোকাল। এখন সেই রোগীর সেটার ক্যান্ডিডেট কিনা, তার জন্য সেটা দরকার। তা না হলে মনোফোকাল দিস ওয়ান, এর মধ্যে অনেক ক্রাইটেরিয়া আছে। বাট মাল্টিফোকাল কাগজে কলমে আবার প্র্যাকটিক্যালি বেস্ট লেন্স, কিন্তু সেটা ওই রোগীর জন্য প্রযোজ্য কিনা বা তার পেশার জন্য যায় কিনা, উনি এটা নিয়ে ঝামেলায় পড়বেন কিনা, সেগুলো একটু বিবেচনা রাখতে হবে। সবচেয়ে দামিটা যে সবচেয়ে বেস্ট সেরকম না, আমাদের রোগীর প্রয়োজনীয়তাটা খুব জরুরিভাবে বিবেচনা করতে হবে এবং রোগীর সাথে কথা বলতে হবে, খুব জরুরি এটা। অন্য যারা আমাদের যারা অনেক আত্মীয় স্বজনের সার্জারি করাতে হয়, সো লেন্সের ব্যাপারে এইগুলো বিবেচ্য, বেসিক্যালি মনোফোকাল এবং মাল্টিফোকাল, তারপরে বাকিগুলো।
Sir, can we this lens is diabetic patient even, sir?
Yes, ডায়াবেটিক পেশেন্টেরও সবাইকেই আমরা ইন্ট্রাকুলার লেন্স দিই। ডায়াবেটিক পেশেন্টের জন্য আলাদা কিছু নাই, কিন্তু যদি ডায়াবেটিক রেটিনোপ্যাথি থাকে বা ম্যাকুলাতে কোনো ডায়াবেটিক ম্যাকুলার এডিমা অন্য কোনো কমপ্লিকেশন থাকে, সেক্ষেত্রে আমরা ওই লেন্সগুলো যেগুলো ট্রাইফোকাল লেন্স, মাল্টিফোকাল লেন্স, এই লেন্সগুলো অ্যাভয়েড করতে হবে।
Sir, thank you, sir. Madam, we are happy that our Chief Physician General, Madam, want to ask something. Madam, please.
First of all, I'm Brigadier General Alia. I'm Chief Physician of Dhaka CMH, and my senior brother from DMC is Dr. Professor Mahabub is over there, and also so many eminent features is within us. We are highly honored today by your gracious presence today. So first of all, the advanced world what are doing, we are also marching parallelly to cope up with that. So we are not lacking behind, first of all. So I think this is a praiseworthy thing that they have done this. I think they, ladies and gentlemen, please put your hand together and a big round of applause for that. Now, I want to say one thing. Whenever our relatives or someone come to our side, they always, because the vision, eye is the main, very not like everybody will tell the heart is the important. Sometimes I utter that word. The vision is more important than even heart, because without our vision we cannot even see this beautiful world. It's not possible. With the advancement of the A's, we are, the way we are getting A's, the same way we are developing the cataract. So this is the point of attraction everywhere. So if we nicely handle the patient, so they can see the beautiful world and they can perform their daily routine activities and whatever the age is that doesn't matter for that. And we are the CMH Dhaka under the leadership of our respected DGMS. He is trying to provide all the support to us. So we are working parallelly to provide all type of advanced treatment facilities towards the nation. We are all working for the sake of the country and our nation. So my thing is that if we work like this and everybody will love to come in the combined military hospital, and also we can work parallelly with our civil counterpart. So the nation will be benefited and our country will be benefited. Thank you all. Thank you very much for this attending and sparing his valuable time to attend this session. Surgery, I don't, it's a clear-cut case, but it's a very, very skilled work done over there without any, good thing is that without any stitch and that the surgery is going on. So I have a query as a doctor, not doctor, as a normal person. What should the next step of that? How long the lens, what is the longevity of this lens, and what are the precautions after surgery? We will going to advise the patient, they will follow up that.
Can I reply how long the lens will stay in the human eye? Yeah. It will stay in the human eye beyond his life expectancy. If he lives 100 years, more than 100 years, the lens will remain as it is more than 100 years. Number one. Number two, একটা হলো যে ইম্পর্টেন্সের ব্যাপারে আমি এটা বলার জন্যই আসলে একটু দাঁড়াইছি, বিনয়ের সাথে বলি যে মানুষের জীবনের পরেই তার দৃষ্টির ইম্পর্টেন্স। জীবন নাই তার তো কিছু নাই, কিন্তু জীবন থাকলে দৃষ্টি কতটা ইম্পর্টেন্ট, যে চোখটা খুবই ছোট একটা অর্গান, কিন্তু চোখের ফাংশনের দিক দিয়ে চোখ নাই, তাহলে আপনারা এখানে যে বড় বড় একেবারে জেনারেল সাহেব থেকে শুরু করে একেবারে সাধারণ মানুষ কেউই কোনো কাজেই নাই। অর্থাৎ চোখের দৃষ্টিটা খুবই ইম্পর্টেন্ট। যার জীবন আছে তার এই দৃষ্টি দরকার, এবং অন্যান্য সারা বডির তুলনায় চোখ ভেরি স্মল একটা অর্গান। আমি যখন ওই থার্ড ইয়ারে পড়ি তখন বলতো যে দুইটা চোখ তার একটা পড়লেই হয়, আর অথচ কোটি কোটি টাকার ইনস্ট্রুমেন্ট দিয়ে আমাদের ইসমাইল সাহেব অপারেশন করলেন। তো এই জন্য যে চোখের ইম্পর্টেন্স খুবই বেশি, ফাংশনাল ইম্পর্টেন্স যদি আমরা চিন্তা করি তো সবার জন্য, আমরা যে কাজই করি উইদাউট ভিশন উই ক্যানট ডু এনিথিং, এটাই খালি বলার জন্য। থ্যাংক ইউ।
Chief Surgeon, sir.
Our respected Consultant General Surgeon, Major General MD Anisur Rahman Hawladar sir is with us. Now, let me take the privilege to introduce two of our national faculties. Dr. Mahmood Rahman Chaudhary, Founder Chairman of Bangladesh Eye Hospital and pioneer phaco surgeon in Bangladesh. Dr. Niyaz Abdur Rahman, Managing Director of Bangladesh Eye Hospital and pioneer of vitreoretinal surgery in Bangladesh. May I now humbly request respected Commandant CMH Dhaka, Brigadier General S.M. Solaiman, SGP MHI MPH PhD, a person with highly professional excellence and a dynamic leader. Sir, please come to our dais and speak. Please, sir.
Bismillahirrahmanirrahim. Respected Director General of Medical Services, respected Consul Surgeon General, renowned ophthalmologist of Bangladesh, dear fellow colleagues, ladies and gentlemen, and members from different places. Assalamu alaikum and good afternoon. I'm not sure whether I am very dynamic or not, or static, but today I feel very thrilled that the eminent professors of Bangladesh in the field of ophthalmology, they are with us. And at the same time, during my tenure, I am not sure whether the earlier one, we have a very live, we watched a live surgery from here, and that is conducted by our eminent ophthalmologist, Brigadier General Ismail, and his team. Definitely, I should give all the credits for this today's program to Brigadier General Ismail and his team. Thank you, sir, for giving this opportunity. First of all, I would like to extend my heartfelt appreciation to our esteemed senior ophthalmologists and renowned eye surgeons for joining us today. Your presence here has enriched this academic gathering, and we are truly honored to learn from your vast knowledge and experience. We have just witnessed a wonderful live surgery, demonstration of phaco emulsification with intraocular lens implantation, which was performed with great skill and precision by Brigadier General Ismail, who is advisory specialist and head of the Department of Eye Department, CMS Dhaka. The procedure was not only a successful one, but also an excellent learning opportunity for junior ophthalmologists. The insightful discussion that took place during the surgery was immensely valuable, and it was very lively. And I am confident that it has deepened our understanding of this advanced technique. At CMS Dhaka, we take pride in our eye department, which is equipped with modern technologies and led by a team of highly skilled professionals. Many advanced ophthalmic procedures, including complex cataract surgeries, vitreoretinal surgeries, oculoplasty, corneal surgeries, including transplantation, are being successfully performed here. The advent of cataract and refractive surgery in Bangladesh is considered as a milestone. To keep pace with that, in military we have started cataract and refractive surgery like LASIK, SMILE, PRK, as well in the year 2021. Like this, we are persuading consistently to upgrade our service to the patients. The discussions and presentation that will be followed by later on will undoubtedly contribute to the knowledge enrichment for all of us. I encourage everyone to actively participate, share knowledge, and exchange ideas so that we can collectively improve patient outcomes and surgical techniques. Once again, I sincerely thank our distinguished guests, speakers, and participants for being part of this event. I wish you all an enriching and productive session ahead. Thank you all. Thank you, sir, and dear audience. Assalamu alaikum.
Thank you so much, sir. It was a great welcome speech to us. Now, may I request our respected head of the department and advisor eye specialist, Professor Brigadier General Ismail Hussain, to enlighten us on world updates on cataract and refractive surgery.
Thank you very much for general introduction of our commandant. Respected Director General of Medical Services, Consultant Surgeon General, Commandant CMH, highly esteemed national faculties who contributed to build up the academia and technical expertise of military eye care. Learned audience, media personnel, Assalamu alaikum. In the next few minutes, I shall try to highlight the latest updates of cataract and refractive surgery in the world. Why cataract? Because cataract is the natural process which is inevitable in elderly persons but may develop earlier. Cataract is a leading cause of blindness throughout the world, although a reversible cause of blindness. The only treatment of cataract is cataract extraction with posterior chamber intraocular lens implantation for visual rehabilitation. Right at this moment, the widely accepted method of cataract extraction is phacoemulsification by phaco machine, and most advanced adjunct technology, femtosecond assisted cataract surgery, we shortly call FLEX. Although it is a long journey to reach to flaps and phaco. For visual rehabilitation, many kind of intraocular lenses are used in the world. Amongst them, the monofocal lens for clear distant vision with spectacle dependence for near work. EDOF, extended depth of focus lens, for excellent distant and intermediate vision without or a very minimum spectacle dependence for near work. Trifocal lens, for panoramic view of the beautiful world for any distance without spectacle. Toric lenses are used for, is one kind of monofocal lens with cylindrical component, which corrects corneal astigmatism at the time of primary surgery. And at last but not the least, tri-toric lens. These are trifocal lenses with toric component. So do the wonders, the panoramic view of distant, intermediate, and near vision, as well as correction of the corneal astigmatism. But to get the best outcome, precise evaluation is the key to success. For selection of intraocular lens, biometer like IOL Master, Anterion, and anterior segment OCT are widely used in the world. For improved visualization, now the Callisto guided 3D microscopes are used in the world. Now a few words about the refractive surgery. Refractive surgery is a procedure used to improve the refractive state of the eye in order to eliminate the spectacles or contact lenses to improve the quality of life. It is a constantly evolving, customized treatment. Widely practiced method of refractive surgeries are topo-guided PRK, that means photorefractive keratectomy, LASIK, laser-assisted in situ keratomiliosis, which is upgraded now from microkeratome to femto-LASIK, and most sophisticated SMILE, small incision lenticule extraction. And implantable Collamer lens is a kind of phakic IOL. And lastly, but not the least, refractive lens exchange. So both the cataract and refractive surgery are ever changing. This is an era of femto instrumentation for best outcomes. The target is safest surgery, happiest patient. Thank you very much for kind listening.
Thank you so much, sir, for the informative presentation. May I now request Lieutenant Colonel Bilal Hossain, Classified Eye Specialist, CMH Dhaka, to present cataract surgery updates in CMH.
With the sequence of presentation regarding advancements of cataract surgery in the world, now I will highlight the present status of cataract surgery in Combined Military Hospital Dhaka. And Combined Military Hospital Dhaka is a tertiary level hospital, so it always maintains its quality up to the world-class level. So all the video presented here, those surgery also done by our respected Professor Brigadier General Muhammad Ismail Hussain sir. So actually, from the previous lecture, we have known that the common and most useful procedure of cataract surgery is the phacoemulsification. It is like a surgery, make an opening at the anterior lens capsule, followed by with emulsification, we remove the nucleus and then we implant a lens within the capsular bag. This is the as usual modern latest procedure. But most latest advance is the femto laser assisted cataract surgery. Usually which we do manually, now gradually those going to be replaced by laser system also. Regarding the advancement of the lens, Usually previously we used to use the monofocal lens. With the lens either we see distance or near, but gradually nowadays you can correct the power along with the astigmatism and other aberration also. Here you can see that we are implanting a lens with a toric marking which also correct the astigmatism. And lens actually, which was I was asking that which is the best lens. Actually, lens depends on the patient ocular status and also systemic condition. Usually, most of the times, definitely we want to give the best vision to the patient, but those also depends on multiple parameter of the patient. So there is a wide expected range, and all the lens from monofocal, multifocal, trifocal, tritoric, ADOF, everything is regularly we are implanting in CMS Dhaka. This is the multifocal lens. You can see multiple crescentic range within the lens inside the eye, which gives vision at near, distance, and intermediate. So CMH is a tertiary center, and so many patients come to us with cataract with multiple comorbidity, either ocular or systemic. And so many patients we find with the cardiac disease and other problem also. And one common complication is that there is a non-dilatation of the pupil due to use of tamsulosin. And especially our nephrologist or urologist use this tamsulosin, and in such cases actually become difficult to handle. Even those cases can be handled with the modern technology which is available in Dhaka CMH. Even in such cases also we can implant the premium IOL. Here you can see this is a complicated case which was not shown here earlier. With the capsular hook we have expanded the iris. Then with the same premium lens has implanted in this case also. So laser cataract surgery. Ultimately, so many our senior generals or even anyone can ask, please, Bilal, is laser cataract surgery available in CMH? Definitely, laser cataract surgery is available in CMH, but most important thing is to keep in mind that laser cataract surgery actually a part of whole surgical procedure. Here you can see we can with the laser we can do only pores and capsular axis and fragmentation of the nucleus, which is around approximately 1/3 of the total surgery. So ultimately, if you will laser, we can use laser, but after that the patient shifted to the normality, then we remove the nucleus as usual normal procedure by phaco and implantation of the lens. So laser cataract surgery means it is a part of a total cataract surgery procedure which is routinely done by phacoemulsification. And to give a precise vision, it is very important to go for the TOTO evaluation. With the basic evaluation to find out any minor defect, we use the anterior segment analyzer like Anterion, IOL master, even topography, ultrasonography, fundus fluorescent angiogram, and sometimes optical coherence tomographical evaluation of the posterior segment also. So, and one thing I can ensure you that the unique thing regarding investigation facilities here that when we find a case with posterior polar cataract, that is a stressful condition for any phacosurgeon, and most of the times it may tear the posterior capsule on which we implant the lens. So with this Anterion, we can detail we can evaluate the posterior capsule. This is a printout of a Anterion printout. You can see there is a posterior plaque which is tightly adherent to the posterior capsule. So if we can find this information before starting the surgery, that will help us to do surgery properly and to ensure the vision. So the glamorous thing nowadays in the world is 3D surgery. In case of 3D surgery, actually it is a surgery using without fixed head microscope, that is head-up surgery. So along with this, all the phacoemulsification procedure are same, but it gives better depth perception and also a comfortable long surgical time for the surgeon. So phacoemulsification surgery, implantation of modern lens is not the only opportunity here. Here we use the opportunity to develop great phacosurgeon. We have the virtual reality simulator where we can get the trainee to become a great phacosurgeon. Even the surgeon who are already expert, they can use to rehearsal or to drill before doing any complicated surgery for a smooth complicated case. So this is the statement. In last 6 months, we have done around 1,400 cases, including serving patient 113. Among those, we have able to give pre-operative promised vision up to 94% cases, and till now our endophthalmitis rate is 0. So the patient in CMH is getting the unique opportunity to gain expected vision after the surgery using the technology and modern lens. And
This upgraded surgical expertise and IOL implantation is our routine procedure, and all the outcome from the CMH, it proves the safety efficacy to make our patient happy with clear vision. Thank you so much.
Thank you so much, sir, for the excellent audiovisual session. Now, may I humbly request respected Advisor Eye Specialist CMH Dhaka, Brigadier General Natasha Kajbina, to speak on expanded horizon of refractive surgery in CMH.
So, namely, actually the refractive surgeries are done mainly on the cornea or the lens. About the corneal procedures, we all know most widely practiced is the LASIK, and then comes the PRK, photorefractive keratectomy, and the latest one to add is the relax smile, that is small incision lenticle extraction. And the lens-based surgeries include the implantable contact lens and sometimes refractive lens exchange. So, just for a clear view, in myopia there is a central steepening. So, the laser is actually applied at the central part in case of myopia, just to flatten it and to correct the refractive error. Again, the opposite thing happens in case of hyperopia. Here, laser is applied peripherally to make it steeper. About the pre-operative evaluation, the foremost important thing is that to know about the refractive requirement of the patient. I mean, the profession-wise, the requirement of the patient is of foremost important to know. And another thing is that the patient must be well conversant about the realistic expectation out of the refractive surgery. All the detailed systemic and ocular evaluation must be done, including the test for dry eye, because we all know that all the surface refractive procedures induce some sort of dry eye, which persists for some time and then it goes away. And another last but not the least, the pentacam. That is we map the whole corneal surface, and many data we collect it from it, and to elicit that whether the person is actually suitable for refractive surgery or not. And just one point I want to highlight is the thinnest location. If the thinnest location is less than 500 micron, actually this person is unsuitable for LASIK. Then we go for other surgeries like SMILE or PRK. And if it reaches a critical value, then we have to switch to the lens-based procedures. This is a range of correction by the different type of refractive surgeries. About LASIK, what happens in LASIK? We create a corneal flap. We make a flap by a microkeratome or a by femtolaser, and then we ablate the cornea with excimer laser for correction. And here, mostly we do femtolaser assisted LASIK because this is a safer technique. About the eligibility, age must be above 18 years, refractive status must be stable for at least 1 year, and patient should be fully counseled about the potential risk benefits. There are many LASIK parameters to be maintained, but just to name a few, the corneal thickness I have told, it must be above 500 micron for LASIK, and this residual stromal thickness must be above 250 micron postoperatively. About the LASIK contraindications, the ocular contraindications include keratoconus, corneal dystrophies, diabetic retinopathy, dry eye, herpetic infection, previous thyroid eye disease. We know that these things induce dry eye itself, so these are the contraindications. Systemic contraindications like connective tissue disorder, and namely pregnancy and lactation. During this period, refractive surgery cannot be done. This is a video clip of a femtolasic done in our center. Here, first docking is done. Then femto laser is being applied for removing the corneal flap. Laser is being applied. Now it is done, and then this anterior flap is removed, and now the excimer laser A is put for correction of the refractive error. Now this is the now time to reposition the flap that we had created, and that's it. No BCL is applied. Now about PRK. PRK is actually the excimer laser ablation like that of LASIK, but without any flap creation. So in this case, no flap related chance of flap related complication is there. But the thing is that here, higher refractive errors, if we correct by PRK, there is a chance of corneal haze. So we do it actually in low refractive power conditions. Now we come to small incision lenticular extraction, that is here. Femtosecond laser is used to cut a lens-shaped piece of corneal tissue. From that, using a 4 millimeter incision, we take it out. And advantage of SMILE over LASIK is there is low risk of flap-related complication as there is only 4 millimeter incision, faster recovery of dry eye, quicker corneal re-innervation, and surface disturbance is minimum. This is a video clip of SMILE done. This is the preoperative spectacular correction. This is the pentacam of that patient done. We do it routinely with all the refractive surgery. First docking is done, and there is only femto laser is used. Here two planes, along two planes laser is applied. This is the laser is going through the posterior plane. Then it is going through the anterior plane of the lenticule. Now is the time to separate the lenticule. First the anterior surface, then the posterior one. This is the separation of the anterior surface of the lenticle. Now we go to the posterior plane. Now is the time to remove the lenticle through a forceps. Then it is done. No BCL is applied. So postoperative vision is 6/6. We go to the phakic IOL. That is the eligibility when we go for phakic IOL, where LASIK or other surface procedures are contraindicated, like the cornea if it is thinner than 500 micron or the patient is having keratoconus. But the thing is that here endothelial cell count must be adequate, and anterior chamber depth should be adequate, and also the angle should be adequate. So this is a small clipping of the phakic IOL done here. First paracentesis is done. Here the crystalline lens is there. Application of the viscoelastic inside the anterior chamber, and the introduction of the implantable contact lens on the iris. It has to go in one go because there is no actually, the place of maneuver is very small. That is within 3 millimeter we have to work here. Now it is tucked behind the iris. Viscoelastic is removed. Stromal hydration is done. So, just to finish, this is our refractive surgery status in our CMH. This is the data of the last 3 months, and this is the total surface refractive surgery that are done here. Thank you, sir. Thank you for patient hearing.
Thank you so much, sir, for the wonderful session. The forum is now open for question answer session. If any queries, you may ask to the speakers.
Is there any question really? We have very short time to answer. Yes, please. Quick.
আয়ের সাথে ডায়াবেটিসের একটা ওতপ্রোত সম্পর্ক আছে। তো এখান থেকে তো আমরা একটা জিনিস ক্লিয়ার হলাম যে ব্যাকগ্রাউন্ড রেটিনোপ্যাথি অর সামথিং এলস অর লাইক দিস ডায়াবেটিক রেটিনোপ্যাথি এগুলো থাকলে তো হয়তো সার্জারি আপনারা করবেন না। বাট হোয়াট অ্যাবাউট দি ডায়াবেটিক কন্ট্রোল লেভেল? যেমন আমাদের এখানে হচ্ছে 8.5% হিমোগ্লোবিন A1C অ্যান্ড অ্যাবাভ, আমরা এটাকে আনকন্ট্রোল ডায়াবেটিস হিসেবে ধরি সিস্টেমিক। তো অ্যাকচুয়ালি কোন ক্যাটাগরি বেঞ্চমার্কটা আমাদের দিলে আমরা তাহলে ফিটনেসের ব্যাপারটা নিয়ে ডিল করতে পারবো। থ্যাংক ইউ স্যার।
Thank you very much. The answer is that the cataract along with diabetic retinopathy, if the damage of the diabetic retinopathy is much and it is that level to be treated, that we shall treat the diabetic retinopathy first, then we shall go for surgery. This is done. And without diabetic retinopathy, the patient is diabetic. What would be the benchmark? Usually, we follow random approximately 10 millimole. If he can maintain 10 millimole, that will be acceptable limit for the cataract surgery. And he will continue the control of the diabetes mellitus as according to your prescription. But for ourselves, diabetes mellitus is not the contraindication for the surgery. We must do the surgery, but the level should be approximately random 10. Is good enough for us. Thank you.
Thank you, sir.
Thank you.
Many of the elderly patients coming to us as a neurologist, taking tamsulosin for long
Yes.
time, having cataract at the same time.
Mm-hmm.
So they are asking, so whether I can take the tamsulosin or is there any alternative?
Okay, thank
I'm
you.
going to the eye surgery.
I got the
So how many days we have to stop
Okay,
or
okay.
at all? Thank
Actually, you need not to stop your medicine. And if you stop for 7 days or 1 month, that will not help. Even the patient who has got the history of triamcinolone for 10 years back, now whenever I go for surgery, there may be IFIS, that is Foppieri syndrome may be present, and the very poorly dilatation of the pupil. And you know, the dilatation of the pupil is the prerequisite for the surgery. So it is not contraindication. You continue the medication, don't stop it. If you require to continue, just stop it. Don't ask for anything. But we shall take adequate measure how to do the surgery. We have ample skill to develop to do the surgeries. We can use many things. We can dilate the pupil pharmacologically, or we can use the different iris expanders. The device can be utilized. But we have to know that patient used this triamcinolone for long last, and so that we can take adequate measure to do the surgery. Thank you. So probably we should stop the question answer session. It is running short of time. Now, I am so delighted to get all the dignitaries here, my respected DGMS, my consultant surgeon, chief physician, and all the national faculties who are my dream. And, I have got two specialties. One is the phaco vitreoretinal surgeries and the phaco emulsification. So here, my phaco trainer here, Dr. Mahbub Rahman Chaudhary, I said that he is the architect of my phaco skill. And here, Dr. Niaz Abdur Rahman sir is there, and he is our dream. Whenever I was doing just the grading courses, then he used to come here to establish the vitreoretina center here. He established the vitreoretina center here first, and he did the first VR surgery here in CMH Dhaka. Then followed by Sajidur Rahman sir. So that we are so delighted to get you all here. Jalal Ahmed sir here. He is my trainer, and my one of the best friend, Khair Ahmed Chaudhary, professor, director come professor. He is here. My joy is no bounds. Now I want to hear few words from all these dignitaries. May I ask Dr. Mahbub Rahman Chaudhary to say, he's a so sweet talker. I want to listen hours together. But what should I say? How much time he could? Okay, take it, whatever time you want. Thank you, sir.
Respected dignitaries, and it's always pleasure and honor to be here. I was here a few months back, and I really love to come back here time and again. And what we have seen today was amazing surgery. And some of the presentation, it was definitely of global standard. Now, as far as ophthalmology, where do we stand? We stand in a place where we can say proudly that we are at the global standard. Today, I can see the phacosurgery. This is the most, number-wise, the highest number of surgeries in the world, because cataract is inevitable and we have two eyes. So number of surgeries globally is the cataract surgery is the highest. And cataract surgery is giving visual rehabilitation, and we get even better vision than what we had before. So these are the techniques and technology that we have. And Brigadier General Ismail has shown us that wonderful display of technique and technology. And I'm proud of you. And what I can see, what we have seen here, this is a standard which we can, if we can achieve, we can say that we are at the highest level. I can proudly say, even if today President Trump undergoes a cataract surgery, he is going to use this machine, he's going to use this microscope, and probably he should have taken this surgeon because he's so good. And we're really proud. We can say, all of us together, we have taken ophthalmology to a standard where we can proudly say we have done the global standard achievement. And this is, combinedly, we have done it. And CMH, what we have seen, is doing a tremendous job, and you people have taken this standard even to a higher level. I'm proud of this institute, and I'm proud that I was invited here, and I would love to come back here time and again. Thank you very much.
Thank you very much, sir. So nice compliment. I wish I would fly. That's right now. Okay, sir. May I request Niaz Abdul Rahman sir to say a few words for us, sir? Thank you.
Thank you, Brigadier General Ismail. Assalamu alaikum. All the dignitaries here, the DGMS, and all the higher officials in our CMH, and the specialists over here. It is a very rare opportunity for us to be present in this world, which is different from the world outside within Bangladesh. But I feel very proud today that I'm here, and I'm very happy that someone like Brigadier General Ismail is with you, because what I've seen in the last few years, that he has gone out of his way to integrate the specialists of this country to come and give their opinion to the medical students that you have that you are training here. And I was also a part of that. Dr. Chaudhary was also a part of that, not once but multiple times. And I really welcome this fantastic gesture that the medical students got an opportunity to be introduced to the higher medical sciences, what they can do in their future before they leave the medical college and become specialists themselves. Today, what we just witnessed over here, the surgery that we saw is what Dr. Chaudhary has said, it is of global standard. এই সার্জারি যেটা আমরা দেখেছি আজকে, এই সার্জারিটা এর চাইতে ভালোভাবে করা সম্ভব না, ফুল স্টপ। So what we have seen is the best surgery that can you do for cataract anywhere in the world. আমাদের ক্যাটারাক্টের যারা টিচার্স, পৃথিবীতে যারা পায়োনিয়ার, তারাও যদি এই সার্জারিটা করতো, this is what they could have done, nothing more. So what we witnessed is the highest standard of surgery that is available in the planet. So that is where we stand. So এর থেকে আর বেশি কিছু বলার আর নাই। Now সার্জারির মধ্যে আরও অনেক কথা আছে, কি লেন্স দিব, কত রকম লেন্স আছে, that is a different issue. But from the technological point of view, this is where we stand. And apart from cataract, I am also a vitreoretina surgeon, and Dr. Ismail is also a vitreoretina surgeon, and Dr. Bilal here is also a vitreoretina surgeon. CMH now has not only other subspecialties, but vitreoretina department is also very rich right now. And you also have, as I know, I was welcomed by a neuro-ophthalmologist, so you have also developed other subspecialties here, which is really commendable. I was lucky enough and I was fortunate enough to give my input in developing vitreoretina in this institute because I was invited by last Colonel General Sajidur Rahman, last Uni Colonel, Lieutenant Colonel Sajidur Rahman to establish the vitreoretina department here and give my opinion of buying the equipment on and also training all the retina OT staff, which I did when I was in Islamia in the 90s. So I was also a part of it, and from then on, vitreoretina services gradually become incorporated in CMH, and now you have a fantastic faculty. So I welcome you all. And I'm sure CMH and the armed forces medical units that we have will and is also giving fantastic service to this country, and now their quality of service is excellent. I mean, you cannot compare it with any other. So I welcome, I would say not welcome, I congratulate all of you, and also I congratulate for doing this session today, which is an eye-opener, especially for the non-ophthalmologist faculty who are over here. Thank you very much for inviting us.
Thank you very much, sir, for your valuable comment. It will encourage us to go even further. And we are very much depth that our academia has been developed by your contribution. Thank you very much, sir. Now, at the last but not the least, may I ask my friend, Professor cum Director NIO, Dr. Khair Ahmed Chaudhary. And I must say that we have started our journey together. Can you remember, sir?
Honorable DGMS, Consultant Surgeon CMH, Chief Surgeon, Chief Physician, Commandant CMH, my respected learned ophthalmologist present here, Professor Jalal sir, Dr. Mahbubur Chaudhary sir, Dr. Niyaz Abdur Rahman sir, Dr. Tawhidur Rahman Bobi, and dear officers of various rank of CMH. I feel honored to be invited and present here in this very wonderful session. Enjoyed the live surgery and three very attractive presentation by Brigadier General Ismail, Brigadier General Natasha, and Lieutenant Colonel Bilal. I worked with these three gentlemen in NIO because the ophthalmologist, the factory house of the ophthalmologist is NIO, and we are working for last more than 25 years in NIO, and it was my privilege to work with these three wonderful persons in NIO. Cataract is still the leading cause of blindness. After the dynamic advancement in the field in terms of advancement of training, equipments, and premier arrival for last 2 to 3 decades, it has tremendous advancement in this sector. We need to improve the quality as well as we need to increase the number of skilled persons. The technologies, the machines, whatever I have seen here today, it is also known to me before, but I will request our those who are the leader in this ophthalmology in CMH, they will fill up their places in future, making the good number of skilled and the quantity people, so that the machine and technologies, those we have seen here, that will not be underutilized in future. There are a cataract surgical rate, in mean cataract surgical rate, that is number of cataract surgery per million population. Mean average globally it is 1400, and in Bangladesh
At moment, it is more than 1,500. Our next target is next 5 years, if we raise this cataract surgical rate up to 3,000, then we can reduce the backlog. So we need to consider how to compensate this backlog too, because if we only emphasize on the quality, that will not reduce our backlog, because we know that 65 million people still suffering from blindness due to cataract, and among them 18 million people in globally, I am telling that there is bilateral blindness due to cataract. So at the same time, we need to emphasize on the quantity as well as the quality. I must thank CMH Authority, Ophthalmology Department, those who have extended their services in this recent anti-discrimination movement. They have given the wonderful service in the eye-injured patients, because all the burdens, we have taken the pain, the National Institute of Ophthalmology have taken the pain of injured patients. At the same time, we have seen that the CMH, other hospitals, Islamic Hospital, Bangladesh Eye Hospital, Vision Eye Hospital, and other private sectors also has given their services to make these patients, their future, a wonderful one. So what is the next of these solutions? We are waiting to get the solutions, because these technologies, these machines are very expensive, so that the newer ophthalmologists are very much reluctant to come in this field. So we are waiting to see artificial intelligence. We are waiting to see the ocular drops, those who will prevent the formation of the cataract. So we are waiting. Probably the next generation will see some other advanced technologies, so that this type of expensive machine will be less required in this field. Thank you very much.
Thank you, sir. Thank you very much for your foresightness. Now we are almost end. May I request our Consultant Surgeon General to say a few words for us, sir, please.
এখন এই মুহূর্তে বলার scope is very less. However, since I'm the surgical consultant general, so I'm feeling rather proud of the excellent performance of the eye department, and we are very glad to have the national legendary, rather I should say the global legendary of the eye specialties with us for their valuable time with us in spite of their busy schedule. Thank you, sir. Thank you very much for giving us your valuable time. So what we have seen, Professor Niyaz sir told, that is the full stop. So probably it's very nice to listen this sort of word. But if the AI would come in future and replace the human service, and the AI provide the whole scenario, maybe some extra new thing will come, and we have to adapt with the development. Vis-a-vis the development that we had in our eye department, probably as you have told, and I'm sure probably the best equipments, facilities we are providing, and we are also grateful with you, sir, that you have all the supports, you have all the feelings. It's that the CMS is also your part of the whole system, academic, technical support, and all this. As you say that amra bole atur ghar, like NIU is like the atur ghar of the eye specialist. So the national institutes we have had in different places, like NITOR is for the orthopedic surgeons, then neuroscience. So these are the places where the specialists are born and developed. So I would like to thank you once again that you will continue your endeavor for the development in our institute. And at the same time, I believe that the improvement where we have reached in the eye arena, I believe that we are in a global standard. Like all other subjects, I particularly think why people need to go outside. I don't understand. Some people, they have the mania or they have money and they go for visits and have a visit to the hospital and then coming. Some people has got some idea, always telling bad about the doctors of this country. ওখানে গেছিলাম এই অনেক কিছু করলো আমার বললো আপনি তো নষ্ট করে আসছেন আপনি তো ক্ষতি করে আসছেন so these are the attitude of some places of some areas but of course not everywhere again if some places our patient goes and they praises if something really done good in the country they tell yes fantastic job done probably as you have come to see us well but whatever your doctor has done is fantastic. So that is the good thing to praise one good job for the others. I don't like to extend my speech, sir. Thank you very much. We hope your continued service. Thank you very much, sir. Assalamu alaikum.
So thank you very much, sir, for your valuable thought, and we are encouraged, we are enlightened. Now, may I request respected Director General of Medical Service, our guardian. We want to listen his thought, his words. Thank you, sir. Please come.
Bismillahirrahmanirrahim. The respected teachers, mentors, living legends. Assalamu alaikum. As Professor Mahbubur Rahman, whom I met in Armed Forces Medical College, our near sir, he is from Boishal Medical College. Professor Khair Ahmed, Professor Jalal Ahmed, and Bobby Bhai. This was the initiative of our Brigadier Ismail. He consulted me few months, rather 1 or 2 months back, that he is going to organize such a session. And as I had the opportunity to serve in a civil medical college, so there I found, not in medical, in the hospital, the Mitford Hospital, I found such sessions to educate the students, the junior fellows, this life surgery. And at the time, I used to feel, are we giving pain to the patients? Because the surgery is going on and the teachers, the surgeons are discussing. So are we making injustice to the patient or not? But of course not, because the senior fellows, senior surgeons of our country participate in the session. So at least the senior person will never do anything which harms a patient or which is not good for others. So I found it for the first time in our CMH. So I congratulate the eye department, especially Brigadier Ismail, to arrange such a session. I pay my thanks and gratitude to all the seniors who came here, sparing the time. It is for inspiration of all of us. As you are here, it is an inspiration. And this will make us to do such programs in future again. So I again congratulate you. I pay my gratitude to you for being here. I pay my thanks to the media who have come. I was not sure so many media people will be here because in army it is not permitted. I think you have taken permission from the ISPR. Oh, you have taken permission. So আপনারা যারা এসছেন, সাংবাদিক যারা এসছেন, অনেক ধন্যবাদ। এটা হাইলাইট হলে সবাই জানবে যে সিএমএইচে আমরা ট্রিটমেন্ট করছি। শুধু এটা না যে আপনারা মনে করবেন না শুধু আমরা আর্মি ট্রিটমেন্ট করি। আপনি জানেন বৈষম্য বিরোধী আন্দোলনের সময় আমাদের এখানে প্রায় 5,000 আমরা কি বলে ভিকটিম যারা তার ট্রিটমেন্ট দিয়েছে, অনেক সার্জারি হয়েছে, বিশেষ করে চোখের অনেক বড় বড় সার্জারি হয়েছে, অ্যাবডোমিনাল সার্জারি প্রচুর এখানে হয়েছে। সো আমরা যেটা করছি দেশের মানুষের জন্য করছি। এখানে আরেকটা বলে রাখি, সামনে হয়তো আরেকটা সেশন আমাদের বন্য ট্রান্সপ্লান্ট উপরে, উই হ্যাভ অলরেডি ক্রস 100। আমি বলেছি যে এখানে আমরা বাইরের সবাইকে নিয়ে আসবো, সো দ্যাট পিপুল আন্ডারস্ট্যান্ড যে আমরা করছি দেশের জন্য, আমরা তো এই দেশেরই মানুষ। তো আমি ফর্মালি আমি কথা বাড়াবো না, আমি আপনাদের সবাইকে আবার কৃতজ্ঞতা জানাচ্ছি। আমাদের যারা সহকর্মী যারা আছেন, I think you have learned many things and you are supposed to learn from such our programs. অনেক ধন্যবাদ সবাইকে, আমি শেষ করছি। আসসালামু আলাইকুম।